I'm Dr. Jimmy Hu. This is your next step on getting better vision. I graduated from the University of Pennsylvania, and then I went to Albert Einstein College of Medicine for med school. Afterwards, I did an intern year over at Brown University, and then I trained over at Montefiore Medical Center for residency. And afterwards, I did a fellowship in cornea and external diseases and refractive surgery over at the Wilmer Eye Institute at Johns Hopkins University. So as you can imagine, that's a lot of years of school. The Wilmer Eye Institute at Johns Hopkins is actually where I credit most of my surgical training and experience from. And it's because I trained with a bunch of people there who are very, very passionate about what they do. And it's an environment where afterwards you leave that place sort of becoming the kind of personality that ends up thinking about eye surgery while you're in the checkout line at the grocery store. Philosophically, I believe that surgery should be boring. And I say this as someone who loves surgery, but philosophically, surgery to me should be boring. And it's because when it's boring, it means that everything's going according to plan. But how do you ensure that everything goes according to plan? Well, in general, if I have a tough corneal transplant surgery or something along those lines coming up, it's because by the time I walk into the operating room, I already have plan A, B, C, D in my head already worked out. So if something happens with plan A, we switch to plan B, and then plan C, and so forth. LASIK surgery, it's probably the best known refractive procedure out there. And I had LASIK myself back in 2014, and it's still one of the best decisions I've ever made. LASIK involves using a laser to cut a circular flap on the surface of your eye. That flap is then peeled back. The laser treatment is then done on the stroma, or the main tissue that makes up the surface of your eye, your cornea. Once that laser reshaping is done, the flap is laid back down on the surface and allowed to heal. This involves using 2 laser platforms, not just one. The first is a femtosecond laser, and that's meant for cutting and creating that flap. This flap is 120 microns thick on average, about the thickness of a human hair, so it's very, very thin and pretty delicate. The second laser is an excimer laser, and that's something that's meant to reshape the surface. So instead of cutting tissue, instead it ablates tissue. And ablate means that it literally lasers and the material evaporates. LASIK, or LASIK, LASIK stands for laser in situ keratomileusis. And that just means the keratomileusis part. It just means that the laser is reshaping the surface of your eye, or in this case, cornea. LASIK has been around for more than 20 years now, and the technology has had some pretty significant advancements. LASIK initially involved using a microkeratome blade, and this was something similar to maybe like a very thin razor that's used to cut that flap on the surface of your eye. And we had issues with it because, as you can imagine, it's literally just something akin to a, almost like a horizontal guillotine. It's not exactly the most, it was very, very fast. The precision had some issues with it. So you have some complications, and then you had more limitations on who you could safely treat without running into problems. Since we've switched to all laser LASIK, which is what I mentioned earlier with the femtosecond LASIK, you're able to make much more precise cuts at a much finer level of detail. And because of that, more people are candidates. And also your long-term outcomes, healing, and everything else is much better. We've also had some other advancements with the laser treatment pattern. Lasers have gotten a lot more precise over time. They've also gotten faster, and they've gotten really, really good at tracking. So I have patients who ask me, oh, God forbid, what do I do, or what's going to happen if I move my head or my eye by accident during LASIK? Or if we were on the West Coast, what is going to happen if there's an earthquake in the middle of my LASIK procedure? Oh my God, what do we do? And the short answer is this is actually not much of concern now, because there is an infrared tracking device built onto the LASIK laser machine. It means that if you move your eye by a millimeter, that tracking device is going to adjust the position of the laser so that it also shifts by a millimeter to compensate. If you move a lot, it automatically pauses and shuts down. And then it does not resume until you get your head back into position, and then the surgeon hits the resume button. If you move your head a little bit, it's fine, the machine will compensate for that. If you move your head a lot, it will pause. and wait for you before resuming. PRK is considered a variation of the same treatment that's done with LASIK, and it's actually the predecessor to LASIK. PRK was around before LASIK came about. PRK stands for photorefractive keratectomy, and it means that instead of a flap being made with a LASIK machine, the skin on the surface of your eye is gently removed in order to expose the stroma that's underneath, and then the same laser that's used with LASIK, that excimer laser, is used to reshape the surface of a person's eye, and then a contact lens is then placed over the eye, and new skin grows back. So that's the reason why PRK is a little bit slower compared to LASIK, because you're still having to wait for time for that skin to grow back. And that takes usually about 5 days or so. But by every single medical study, there is no difference long-term in a person's vision whether they've had LASIK or PRK. Technically, everybody could benefit from LASIK, but we don't recommend LASIK for everyone because we want you to get the best or the most kind of benefit possible. The last thing that I tell a patient is, the last thing I want to do is an unnecessary medical procedure or a procedure that's not going to give you the result or the outcome that you're hoping for. What happens during LASIK is almost like a glasses prescription is etched onto the surface of your eye. So whatever you see with glasses or a contact lens, that's what your vision is like afterwards. Which also means that while the effects of LASIK are considered permanent and it will last for the rest of your life, your eyes are still subject to normal age-related changes. So your ideal LASIK candidate is going to be somewhere between the ages of 20 and 45. And it's because they're able to see pretty well with one pair of glasses, and your eyes are able to adjust to seeing things at a distance and up close. For anybody who's over that age, it means that yes, your eyes are subject to normal age-related changes, and that happens whether you've had LASIK or not. And it means that if you had LASIK and you're, say, 50 years old and needing reading glasses, you will still need reading glasses after LASIK. The main difference is instead of having to get progressives or bifocals, you're just using the over-the-counter reading glasses. So when we evaluate a person for laser eye surgery or laser vision correction, we do a lot of tests. And again, it's because safety is the most important thing to us. We care very, very deeply about never doing a medical procedure that's not in a person's best interest. If a person has a medical condition that would preclude them from LASIK, I'm very candid and upfront with them that no, LASIK is not in their best interest, or LASIK will not give them the result that they're hoping for. Ultimately, we do a number of scans of a person's eye when thinking about LASIK. The main one is called corneal topography, and we use something called a Oculus Pentacam. And this is a machine that creates a custom map of a person's eye and does scans about 20,000 points of what the surface of their eye might be like. From there, it creates a 3D model, and we look at any lumps, bumps, hills, and valleys on the surface of their eye. And if there are significant irregularities, we know that that person might not do so well with LASIK because the structural integrity of their eye may not be able to support or sustain it. If so, then they're at risk for a condition called corneal ectasia, which means that the structure that makes up their eye is less stiff than what a normal person might have. And so when you do any kind of laser reshaping procedure on it, those effects, while short-term, it will give them excellent vision, long-term, those effects may not last because their eye might warp into form over time. If you're happy with your contact lenses, then there's no big reason to need laser eye surgery because very few people truly need laser eye surgery. But there's a huge convenience improvement that happens when a person gets laser eye surgery. And it's why? It's because it's really nice having, or just being able to just wake up and go. Or it's really nice not having to deal with contact lenses, putting them in and taking them out, or dropping them somewhere, or when you're traveling, having to bring more stuff with you, or worrying about getting your hands dirty. No. So not everybody can have PRK either. Just like how not everyone's a candidate for LASIK, not everyone's a candidate for PRK. And again, it's because the last thing we want to do is a procedure not in someone's best interest. If a person, again, has medical conditions or ocular issues that would prevent them from having laser vision correction, that includes PRK, but this is all part of a thorough evaluation. Short answer is no, you don't need to have a referral note from your eye doctor. If you have a regular eye doctor that you follow with, we do try very hard in order to contact and correspond with them, because ultimately that's good medicine. This is a person who's part of your eye care team. They're still going to be part of your eye care team and your healthcare team before and after your laser vision correction surgery. That won't change. But no, you don't need to have a note from them. It does make the process a little bit easier though. So there's no such thing as a zero risk procedure. That does not exist in the realm of reality. There's just as much risk with crossing the street as there is with getting into a car and being the one driving. Ultimately, LASIK is considered extremely safe, but again, there's no such thing as a zero risk procedure. I can say that LASIK is considered extremely low risk. I've personally never had a patient go blind or lose vision. You have the occasional patient who may not have perfect vision afterwards, although a lot of them will have very good vision. And then there are things that you can do in order to try and improve their vision to the best that they can see. And that's always the goal for any LASIK surgeon, to give a person the best vision they possibly could have. Not the best vision that's humanly possible, because again, we're all built a little bit differently and there are limits as to what we can do. But the goal is to give a person the best version that they could possibly see. In general, the effects and results from LASIK are permanent, and they're meant to last for the rest of your life. But that being said, your eyes are still subject to normal age-related changes, and that will happen whether you've had LASIK or not. So if a person who is 30 years old and getting LASIK chooses to undergo LASIK, yes, those effects will last. But regardless of whether they've had LASIK or not, by the time they hit their 50s, they're going to need reading glasses. But again, the main difference there is, instead of having to get progressives or bifocal reading glasses, they're just getting the over-the-counter reading glasses. And they're only putting them on to read. To drive, they won't need glasses. To watch a movie, they won't need glasses. So in general, nothing is truly permanent, but the effects of LASIK are thought to be permanent. About 5% of the population after LASIK will have what's called regression. And this is expected. It's also why we, at least at our practice, we offer any free touch-ups and enhancements for any patient who's had LASIK with us. But the enhancement rate, again, nationwide, is about 5%. What does that mean? It means that after some number of years after the initial laser vision treatment, they might still have a small glasses prescription afterwards, again, because of changes that might happen to their vision over time. And so you can always do a touch-up for that. In general, for a 20-year-old person getting LASIK, no. For someone who's 50 years old and needing reading glasses already, and they're a little nearsighted, it means that yes, they'll need to wear reading glasses afterwards. Why? Well, if you're nearsighted, you're able to read a book without glasses, but you're having to wear glasses in order to see things at a distance, like to drive or watch TV, then if you choose to have LASIK and have your vision corrected to see things clearly at a distance, the opposite is going to happen. You'll see very clearly at a distance, you'll be able to drive, watch a movie, but you'll need to wear over-the-counter reading glasses in order to read a book or use a computer screen. And some people might wonder, well, if I have to wear glasses half the time, is that still worth it? And when I think back on it, I actually had a 79-year-old lawyer tell me, given that even though he spent 80% of his day reading and in front of a desk and looking at screens and books, he said, I would always rather wear glasses to work than to play. And so he cared more about being glasses-free while looking at things at a distance, because for him, he wanted to be able to golf without having to wear glasses. So shortly or short term, after LASIK or PRK, a person's vision is going to be worse at nighttime. They're going to have a lot of glare and halos at nighttime. They might be a little light sensitive from car headlights. This is normal. This is expected. This happens to 100% of people. A lot of this has to do with the recovery process after LASIK and that flap settling down to place, and changes that happen to a person's eye after one of these laser vision correction procedures. This eventually settles down, and gets better. But how long that might take, it's usually somewhere between 1 and 3 months, but everybody heals a little bit differently. For some people, it's on the longer end, for others, it's on the shorter end, but usually it's somewhere between 1 and 3 months. But yes, that light sensitivity at nighttime is no joke. That is something that everybody notices. So in general, 100% of people will have dry eyes after LASIK. And again, this is normal and expected. It usually goes back to whatever level of dryness that they had before LASIK, somewhere between the 1 and 6 month mark. That does happen. And a small percentage of people still after 6 months after LASIK, they still have some dry eyes. That does happen. Why? It's because LASIK reduces the sensation or sensitivity of your cornea. And in the process, it means that sensitivity means if your eyes are dry, it's going to secrete more tears, or it's going to tell your brain to make more tears and then secrete more tears. But when you don't have that sensation, that feedback loop that tells your brain to make more tears if your eyes are dry is diminished because the signal is weakened. So this is why some people do have dry eyes after LASIK. This happens a lot. Again, it's normal, it's expected during the recovery process. You do have some regeneration and return of sensation that happens over time. It's never 100%, but it's very close. And so that's why only a few people have long-term dry eyes after LASIK, but those people do exist. So in general, from an insurance company standpoint, they only care that you can see well with glasses, which means that LASIK, which is intended to help you see better without glasses, is considered cosmetic from an insurance standpoint. Some vision insurance plans will give you a rebate on the cost of LASIK, but that really depends on everybody's insurance plan, and everyone might be in a different situation. The only healthcare plan that I know of that covers the cost of LASIK is US Army, Navy, Air Force TRICARE, which is understandable. But for everybody else, it's considered cosmetic. And so for them, it's an out-of-pocket expense. You can use FSA and HSA dollars for LASIK, but yes. And then yes, there are payment and financing options available for LASIK. So in general, LASIK is painless. And why is it painless? Because we give you numbing medication before the actual procedure itself. So I tell everybody that during the procedure, you might feel a little bit of pressure on your eye, but you shouldn't feel any pain. And if you do have any sort of sensation of pain or discomfort, let your doctor know, because it means that during that time, they might adjust the position of your head and any instruments and give you more numbing medication. But you are not meant to feel anything during the actual LASIK procedure itself. Your vision might get dark, you might see some flashing lights as part of the process, you might feel a little bit of pressure on the eye from the doctor working with their hands and moving instruments around the surface of your eye, but you should not feel pain. After the procedure, once that numbing medication starts to wear off, a person is going to feel like their eyes have been scratched or cut by a laser because it's been cut by a laser. And again, that's normal and expected. You might feel a little blurry, light sensitive, scratchy. Again, this is all normal. So the procedure itself takes probably less than 20 minutes. It's pretty fast. The actual laser treatment itself is less than a minute. Yes. So in general, since you're coming in to have a procedure that gets you out of glasses, we try in general to do both eyes at the same time. So you're not dealing with wearing a monocle or something silly like that. No, we do both eyes at the same day. So in general, we want you to be out of contact lenses 2 weeks before the actual laser vision correction procedure. And why? It's because contacts act like little suction cups on a person's eyes. And because of that, much like after you remove a suction cup on your skin, the surface of your skin is going to be indented a little bit from where that suction cup used to be. So I tell every patient, before we do the laser vision correction procedure, make sure you're out of the contact lenses for 2 weeks. And it's because I care very much about precision. When you shoot for the moon, every half degree matters. In general, yes, when you can come into the laser vision correction or you can come into the LASIK center by yourself, but we need to have someone take you home that same day. And why? It's because after the procedure, you're going to feel a little bit dizzy, light sensitive, disoriented, and we don't want you tripping over any stairwells or any railings or falling down a flight of steps. Nothing along those lines. We want you to be able to get home safe, go home, chill out, and take a nap. Time and suction is the short answer. So after the laser vision correction procedure, or after LASIK, there's a flap that's made, and that is laid back down on the surface of your eye, and your eye's own natural healing process is going to seal that flap in place. And how does that work? It's because the surface of your eye is covered in skin cells, and skin cells form a web that stick to each other. And after the LASIK procedure, there is a cut naturally that's made on the surface of your eye, similar to how a paper cut can be made on your skin. And so it does self-seal because your body has these wonderful healing and repair mechanisms in place. And the initial seal takes about 24 hours, which is why we tell you, go home, take a nap, give it 24 hours for your vision to get a little bit better. And that layer stays in place unless you get cut, punched, hit in the eye, or something along those lines. You do still have a flap that will permanently be there on the surface of your eye. There's going to be a cut. It does seal more tightly over time, but especially during the first month after LASIK, it hasn't quite sealed down into place, which is why we tell you do not rub your eyes for 1 month after the procedure. So in general, I tell everybody, plan to give yourself 2 or 3 days after the procedure just to rest and recover. This is a little bit longer depending on what you might be doing for either on a day-to-day basis or for work. But if you're sitting in front of a computer and you're not doing any heavy, strenuous physical exercise as part of your job, then it's usually about 2 to 3 days. But that being said, everyone's going to be a little light sensitive. Their vision is going to fluctuate. So I tell them, you're not going to be 100% back to normal at around 3 days. Instead, it might be a little light sensitive. Your vision might be a little bit blurry when looking at a computer screen or reading emails. You may not be operating at 100% capacity right after 3 days. It might take you a little bit longer to read something, or it might take you a little bit longer in order to scroll through your giant email inbox. Again, your brain and your eyes have to get used to the changes. A person is typically driving at around 3 to 4 days after LASIK. It might take a little bit longer for nighttime driving, and that's because of the glare and halos that happens and the light sensitivity. But everyone's a little bit different there. But at least driving during the day, typically about 3 to 4 days. So I generally tell every patient, wait at least a week before doing any heavy, strenuous physical exercise after LASIK. And it's because they've had a medical procedure done. And even though it's a very small wound, it's still a wound on the surface of your eye. So we want you to avoid any straining activity, certainly avoid any sort of activity where you might get punched or hit in the head, but at the same time, weightlifting, going to the gym, any kind of activity where you might strain yourself trying to lift something heavy or you bear down and push your body, wait a week on doing that. So most people are seeing better within 24 hours after LASIK. It's not 100% what their final vision is going to be like, but they're seeing well enough that they're able to watch TV, maybe read the subtitles while watching Netflix, but it's still going to be a little bit fuzzy at that point. It's not going to be clear. Over the course of the following week, they'll still have some small fluctuations. Again, some days will be a little bit better, other days will be a little bit worse, but on the whole, it will get better. And most of our patients are seeing 20/20 in about a week. But again, everyone's a little bit different. What's average does not always imply that that's going to be a person's individual experience.